Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to our confirmed cases and contacts to cases in the community. We are thankful for the way that these individuals have cooperated with our team to help lessen the risk of transmission to others. We know that getting a positive test result or being told that you're a contact to a case can be very scary. And we are very grateful to those folks for their willingness to follow our guidance in an effort to protect those around them. Moving on to our local situation. We have 367 confirmed cases of COVID-19 in Knox County. A quick note about this data point. We have 3 new cases today, but after our investigation, we also transferred out two out of our jurisdiction due to the residents elsewhere. So there appears to only be 1 more in our counts online today. Additionally, we have 10 probable cases. 315 of our cases have recovered. 40 individuals have been hospitalized at some point in their illness, and 2 Knox County residents are currently hospitalized. And we are also thankful that we have no additional deaths due to COVID-19 at this time. Beginning next week, we are piloting a new process for our testing. Walk-up testing will be done on Monday, Wednesday, and Friday from 9 a.m. to 3 p.m. inside Knox County Health Department's main location at 140 Dameron Avenue. There will be signage outside the building that will show you people where to go. This shift in process will help us more efficiently use our team members while also protecting them from the anticipated summer heat. Individuals who wish to be tested will no longer need to call our public information line. They can just show up at a time that best suits their schedule. We will pilot this process next week and we'll make adjustments as needed. We anticipate volume may be high, so we ask that you please be patient when you come. Tuesdays and Thursdays will continue to be reserved to do targeted testing to reach high-risk individuals and those with less access to testing. Before we open it up for questions, we just want to briefly mention that we noticed several comments on our social media page that detail complaints against businesses. We encourage people to call 311 if they have questions or complaints about how businesses should operate during the reopening plan. And with that, I'll open it up for questions.
Any questions, please go ahead and submit them into the chat feature now. And as a reminder to please type your name as well as the media outlet that you're with. The first question is from WBIR. As we start to see a little bit of an increase, are you watching places like Hamilton County at all? It started with small increases a couple weeks ago and now has doubled the number of our cases.
Yeah, we try to keep an eye on what's happening around us, mostly in our region, but keep our ear to the ground to other areas and learn lessons from them when we talk on state calls and that type of thing. So again, and we're watching our data very closely every single day, so we can continue to update the public and make recommendations as needed.
Another question from WBIR. How many red lights will delay moving to the next phase, and how many will require us to move back to phase 2? I believe they mean phase 1.
Well, again, let's talk about how there's a lot of data points and we don't consider any one data point. And so it's really what the whole picture looks like. So for example, there could be, if we have red light for new cases this week, but it's a relatively still small number because as we said, we started out with a small number of cases. So any increase in cases pretty much can be a statistically significant shift. But we do want to pay attention to that. So red lights are warnings, just like yellow lights are, to take a much deeper dive into the data and look at the information. But it's not just that alone. We still want to know about hospital capacity and the ability to take care of these patients, our ability in public health to track the new cases and do contact tracing and make sure people get into isolation and quarantine. So it's not a hard and fast answer. And we try to be very clear with that in the reopening plan and what we say on the website. So I can't give you a hard and fast one, but we do look at all of the data and we will make recommendations based on all the data and explain that when we move forward.
From David with WBLT, is there a concern as phase 2 continues and the perceived lack of people wearing masks?
It is concerning when you're out in public and we're not seeing people wearing masks. And we continue, because that's one of the ways that we protect our neighbors and our community members, along with maintaining social distancing and washing hands and staying home when you're sick and all of the things that we ask people to do. So we ask that people take this seriously. The recommendations are in place to protect us, and continue to move forward.
From Brian Hornback, do you have a number of how many people has KCHD asked to be on quarantine?
Well, so isolations for our cases. So all of the cases would be in isolation, and in quarantine, I think we've monitored over 1,200 contacts, and all of those would be placed in quarantine as well and monitored daily.
His follow-up question is it only positive COVID test results or also individuals that have been contacted by contact tracing?
Yes. So to explain that best of all, so we'll start with cases. So a case gets identified if they're laboratory confirmed and they're placed in isolation, and then follow the guidance for that. And then we contact all of their household and other close contacts, and they get placed into quarantine, and we do daily monitoring with those folks as well. If one of those folks becomes symptomatic, we call that a probable case, and those then start following the same guidance for new laboratory confirmed cases at that time. And then we talk to their contacts and so forth. So that's how that process works, if you need more clarification on that. But we treat a probable case, which is, I think, what you were asking about, the same as a actual laboratory confirmed case.
From WBIR, what is your message to people who say they are, quote, over COVID-19 and say things need to be normal?
I get it. I feel the same way. But the fact is COVID-19 is still here. It's going to continue to be here. And our loved ones and people in our community are still at risk from getting this and having complications with this. And so we need to continue to take it seriously. And when we make small adjustments, we can still go out and, patronize restaurants and shops and do all of those things. But we need to do it safely so that we're protecting our community.
From Austin with WATE, we have had 10 probable cases for several days now. Why have they not been clarified yet? Is it a delay in test results?
No, they don't always have to get tested. And so they may still be in there, and numbers can be floating in and out. So it could be new probables added, some turned into cases because they got tested and the number just happens to stay the same. But people, if they don't want to get tested, they don't have to. But again, we still have them follow the same isolation guidelines as a laboratory confirmed case. So there's a lot of different things in there that can make that number either go up or down or stay the same, just like any other cases that we work with.
From David with WVLT, what do you say to people that say wearing a mask is an infringement on their rights?
Again, I can understand that in one way, but I think it's really, and what we encourage people to look at it as, is not as an infringement on your rights, but as you trying to look out for your neighbors and your loved ones and your community members, and doing what's right to help protect them.
Any other questions? Please go ahead and submit them into the chat feature now. From WBIR, we have heard of the high impact on Hispanic communities. What are you doing to help those communities?
We actually gathered some information just recently, had essentially like a little focus group to find out how we could better communicate and get messaging to those communities. And we've been reviewing that information and then looking at strategies on how we can better communicate moving forward with our Hispanic community. So hopefully more to come on that very soon. That's what we're actively working on right now.
From WBLT, David asks, what is the needs at this time for KCHD to fight the virus? Any shortages?
From our perspective, no. We need the community to cooperate. We really want that. Like we said, we expect that new cases will come in as more people are out and about more and have more exposures, but we need that number, while it can rise, we need it to kind of level off relatively quickly so we can continue to do our work. We need people that are cases and contacts to continue to follow our recommendations and stay home and not continue to potentially put other people at risk. All of those things are very important. But right now we have the resources we need to do contact tracing and investigations and monitoring, and also to continue to do our testing as well. We're just going to be doing that a little differently.
David with WVLT also asks if there's any more information on clusters.
No, no additional information at this time. We're still working those cases, and we would make any information that we needed to make public if we needed to.
From Brian Hornback, Knox County School Board met in person last night. What did KCHD think of that?
Well, I didn't realize that happened. So we just wanted to make sure, and with all cases, that people follow the social distancing guidelines. So people can meet in person, but we ask that they, stay 6 feet apart, wear a mask, they wash their hands, they don't participate if they're sick. The number of in phase 2 are groups of 50 or less. So all of those things, we just ask that people continue to follow the guidance as you move through this next phase.
Any other questions, please go ahead and submit them into the chat feature now. All right, since there appears to be no more questions being submitted, thank you all for joining us. We will see you tomorrow at the same time. Have a good rest of your day.